Your live.
Hi, this is Dr. Nikitha, consultant obstetrician, gynecologist, and laparoscopic surgeon at Kim's Hospitals, Gachibowli. Today, I have my neonatologist, Dr. Sindhu Maru, who's here to help out all the new moms to identify what is normal and what is not normal.
Hi, I'm Dr. Sindhu, consultant neonatologist and pediatrician, Kim's Cuddles, Gachibowli. Let's have a small conversation regarding what are the most common questions we get for being a new mom. So let's start.
Yeah, so Dr. Sindhu, most of the times when mom to bees, they are preparing their hospital bags, and so they're so confused as to what shampoo to use, what soap to use, what body lotion to pack in. Can you give them an insight on it?
Yes. So there is no particular brand. If any brand, if I say it will be like a promoting a brand. But the main thing we all should keep in mind is the pH of the brand, whatever we are using it. It's around the pH should be around 7 to 7.2. If the pH is good, then that is safe for the baby, whichever brand you are using. But while packing and antenatally, the main thing I would say more than soap, shampoo, its own main important is cap, glove, and socks, which is very very important. Dressing of the baby is very very important. And second thing is preparing antenatally your mind for a breast milk is very very important. This is the main two things which you should antenatally prepare. And when you come for the products which you want to use, it depends on the pH, then the main the brand. That's it.
So, like Dr. Sindhu rightly pointed, I think it is important that you know about breastfeeding even before the baby is born. Because the minute the baby is born, multiple questions that pop out is my breastfeeding sufficient? How often should I be feeding my baby? Should I wake my baby up multiple times to feed the baby? How do I check if it is normal? What position should I be feeding? After every feed, is burping essential?
So yeah, all these questions prior to this, a small thing is we all should keep in mind that the breast milk from the mother not only comes after delivery, they start producing before delivery. So the myth of all everyone says that as soon as the baby is born, my milk is not sufficient, I'm not getting enough milk. You can't express and see how much milk you are getting as soon as the birth happens. No, you will get a drops of blood. That is more than sufficient for the baby. If you want to quantify at the time immediately after delivery, if you see the size of the abdomen or size of the stomach of the baby, it will be just like a cherry. Just imagine how much ml of milk will be sufficient in a cherry. It's just around 4 to 5 ml. So your milk, whatever is producing, starts from the antenatal part. So next question ma'am was asking is about how often should I feed. So it's like a demand feed. Hard and fast rule is like a demand feed. Whenever the baby wakes up and cries, you have to feed the baby. But the initial few days, the baby sleeps more, like around 20 hours, 22 hours, they keep sleeping. So we should not skip for the baby feeding. So every second hourly, at least wake the baby up and keep feeding the baby, so that it will be sufficient for the baby. So it's tough to wake the baby up. It's very tough to wake the baby up. But yeah, we should wake the baby up and feed every second hourly. And next question, sufficiency. So most common question is my milk sufficient for the baby. See, sufficiency, it depends on the baby. Each baby is different. Each of us is different. In the same way, each baby is different. So sufficiency, if you want to quantify and see, and when you are at home, it's mainly number one, it will be like urine output. So in day one, 1 to 2 urine. Day three, day two, 2 to 3 times of urine. From day three, minimum 4 to 6 times of urine baby has to pass. And if you're putting a diaper and saying minimum, if you should full diaper of around 4 to 5 times, you're changing a diaper. That's a good amount of urine your baby's pass. And second thing is baby should sleep around 1.5 hour post feed, at least minimum 1.5 hour baby should sleep well rested. Sound sleep baby should have at least 1.5 hour. And unless your baby is like who wakes up for a single click, we can't say that, but usually the baby should sleep around 1.5 hour post feed. That shows at least the amount sufficient for the baby. And second thing is, after few days, if you see, you can feel that emptiness of your breast after feeding. So that says that at least the baby is taking the milk. And while feeding also, we should all keep in mind, just the sucking is not important. When you see the jaw part, whether the baby is taking and swallowing, you can hear, sometimes you can hear the gulp, the swallowing gulp. That shows that the baby is taking milk and it will be, you're getting a milk. And positioning. So you can give any positions. N number of positions are there, like a football position, cradle, cross cradle. All the positions you can try, whichever you are comfortable. Some mothers say that they are comfortable with football position and all. Whichever is position is okay. And next common question is post cesarean, and the mother is not able to sit so early and all those things. Yes, mother can feed while lying down, definitely. And when you're giving in a side lying and all those positions, keep your hand at just upper part of the body should be around 30 to 45 degrees up, so that the milk will not come out and get swallowed in the trachea or all those things. So keep the head and a bit of elevated, and you can feed in the lying down position also. And the final last question you were asking about burping, madam. So the burping is yes, you have to burp the baby, but second thing is it's not compulsory for the baby to get burp. Okay, and you don't keep tapping the baby for 1 hour or 2 hours until the baby burps and all those things. Keep the baby in upright position, either in case of the KMC position or on the shoulder, or if you baby to comfortable in the sitting position, you can do tap the baby for about 5 to 10 minutes. It's okay if the baby burps. It's okay if the baby doesn't burps, but you try at least around 10 to 15 minutes and make the baby sleep normally. However, the baby is in position is comfortable.
So I think she's cleared a lot of myths about breastfeeding. I would like to add in one point here. So when the mother is breastfeeding, you need to ensure that the baby empties one breast before the baby moves on to the next breast. Mainly because in the breast milk itself, if you notice, the initial few drops are for the thirst.
Yeah.
So it is more of the watery content, whereas the hind milk, which is there, is more of the fat content. So you need to make sure that baby gets all the nutrients. And it is essential that you empty one breast before you move on to the other breast, because some mothers feel that the baby is still crying, so I give 15 minutes one side and 15 minutes the other side. So ideally breastfeeding 30 to 35 minutes of each breast is what is ideal for us to make sure that the breast is emptied.
Yeah, just a point. First 3 days it will be like in colostrum of milk, so there is no difference in the whole milk and hind milk. So first 3 days you can feed however you want. After that, the concept of whole milk and hind milk comes. As ma'am said, that's very true. That complete one breast and go to the other breast, so that the milk completing the breast will give you both whole milk and the hind milk. That will helpful for the baby to gain the weight.
The most commonly asked question when I go for my post-op rounds is, when can I start giving bath to my baby? How do I take care of the umbilical cord? And is massaging good? And if it is good, what oils to be used?
Yeah. So bathing. So there is no hard and fast rule when to bath. You can bath within 24 hours of the baby's born also. But the only thing we keep saying is cord. So if you bath the baby early, but you should keep the cord dry. Or else you can wait until the cord falls on the bath. That's also the good idea. These are all I'm talking about the term babies. Like babies who are born like after 38 weeks and with a good weight of more than 2.5 kgs babies. So you can bath the baby within 24 hours, or you can wait the baby till the cord falls. But the only thing is if you're bathing the baby in the early part, then keep the cord dry, because otherwise either it will get infected or it will be delay in the falling of the cord, and it will be a problematic later part. So first bath is that. Next comes massage. Yes, you can massage the baby after the baby is born, whenever the baby is comfortable, and it is gentle massage. The word which we keep saying is gentle massage, and we don't need so much of training or so much of expert people, but do a gentle massage. You don't need to hire someone for an expert thing to do, but now we have so much of information in social media too to get and how to massage the baby. Do a gentle massage, and minimum of coconut oil is more than sufficient. And the remaining sesame oil, whatever, olive oil, or all those things, you can use it, whichever is fitting for your baby. That's very clear. If you start with an olive oil and start applying, and if you see a reddish rash all over the bed, please stop the oil, change the oil and see. It's because we don't know what oil fits for the baby. And the add-on is, ma'am, color doesn't depend on oil. Very common thing. Everyone say that my baby after starting coconut oil change it to dark or so much. All these things, no, it doesn't. Color is mainly depends upon the genes in the baby, but it doesn't depend upon the oils.
So I'm sure you often notice that mothers are rubbing the babies with the wet wipes. What is your take on wet wipes? So wet wipes, wipes and diapers, two things which we commonly use being in newborn. Before birth only we keep ready everything. See, diapers, if I start with the diapers and diapers you can use if it's a cotton based wipes, whatever brand, whatever organic, inorganic, chemical based, whatever diaper is a diaper, it will definitely cause rashes. For the baby, and if it is not changed in time, or if it is not fit for the baby, it's not comfortable with the baby, they cause rashes.
So usually diapers, we don't advise if mother wants to use it, frequent change in diaper if it's chemical based or whatever. Cotton based, yes, you can definitely use a cotton based diaper because we have a cotton layer which is very soft and comfortable for the baby too. And wipes, whatever, all the wipes, whatever we have is like a scented wipes. Though we call 100% of water wipes and all those things, we have scented wipes. So in that wipes, obviously chemical, mild chemical, at least that newborn skin will cause the rashes. So better to use a cotton cloth with warm water to clean your baby's poo, and that can be used. So wipes are not that preferable to be used.
Especially the scented one.
When you're going out and when you're coming out of the your house in comfort zone, yes, there is no other go. Then that time at least, but not continuous usage will be so comfortable for the baby.
I think in today's world, we're talking so much about sustainability. So if you're using disposable diapers, I think imagine the amount of wastage. So if you are a confident mom, I think like Dr. Sindhu rightly pointed, cloth-based are very, very safe, and we can reduce so much of wastage there. And wipes, yes, you can use wipes, but not scented wipes. That is the take-home point. I think today, out of the discussion, if there's one take-home point, the one take-home point should be that no using the scented wipes.
Yes,
because we see left, right, and center all babies smelling of different kinds of flowers. So ideally, it is not essential to use scented wipes.
Yeah.
And when there is a new mom, we see a grandparent sitting right there, asking to expose the child to sunlight for at least 30 minutes, and she thinks that that is the treatment of jaundice and not phototherapy. So what is your take on sunlight and how safe it is?
So jaundice and sunlight, we always see that interlinked to each other. First thing is jaundice. Jaundice usually appears at around 48 hours of life, which if the baby is getting discharged for a normal delivery within 24 hours, we will see and then discharge the baby. So the sunlight is not directly think is a treatment for jaundice. Though the concept of phototherapy has come from the sunlight, but the wavelength of phototherapy which we keep in our hospitals is not the sunlight proportional to the sunlight. So yes, sunlight you can give in the morning hours around 7:30, 8 o'clock, or indirect sunlight when you can put near the window, the baby, you can take the baby near the window and keep for about 30 minutes. At least we get vitamin D than compared to the another jaundice. But jaundice, the main treatment I would say from the mother is breast milk. If you feed the milk, if you feed the baby well enough and good, definitely the jaundice chance will be coming down. So yes, sunlight is yes, either it for a jaundice or the vitamin D, but not the direct sunlight, at least indirect sunlight from the windows or from the balconies. You can do it at least for the vitamin D.
So the take-home point here is that we are not against sunlight or for sunlight. So if you're using sunlight as the source, what she means to say is it has to be a filtered sunlight where you're exposing the baby near a window so that filtration happen and there are no harmful rays, especially because of the kind of pollution.
That too in morning hours, because the babies are very sensitive, they get dehydrated very soon. So in around 7:30, 8 o'clock in the morning hours, you can put around 20 minutes, 30 minutes. That's more than sufficient.
So when we are discharging the baby, what is your checklist for all the screenings to be performed?
Oh, yeah. This is very common thing and very important for the babies now. There are 3 screenings for any baby after discharge, either a normal delivery or a cesarean. Number 1 is pulse oximetry screening. Before discharging the baby from the hospital, the doctor who sees the pediatrician who sees the baby will do a pulse oximetry screening. What is it is? It is useful to detect the critical congenital heart disease, which is done by the doctor itself. So they will do it and they will send you to the home. Number 1. Number 2 is next comes with that of the hearing screening. Hearing screening is usually done about 24 to 40 days after. So that has to be seen. Then the 3 very important is newborn screening. Newborn screening is screening for genetic conditions or metabolic conditions. So whether the family hereditary or not, it is a hard and fast rule. We have to do a newborn screening, and then different panels are there. If you are not happy with the highest panel based on the economical issues, but at least a minimum of panel of 7 conditions, which is most common in India, like thyroid, which is very common in India. So that can be tested and sent. So newborn screening, please make sure that all the babies get a newborn screening done before they get discharged. So as we follow the same hard and fast rule, like all our babies should get a newborn screening or a minimum of thyroid at least before they get discharged.
There is a common myth that if I breastfeed my baby, I'm not going to give any vitamin syrups. Because yesterday I did have a mother walking into the OPD and she said, we don't give any vitamin syrups to the baby because I don't want to give anything from outside. I have been told exclusive breastfeeding. So I do know that you discharge
Yeah.
all your babies with vitamin syrups. Can you educate the mothers the importance of it?
So yes, your breast milk contains all the vitamins, but except vitamin D. So vitamin D should be supplemented to the baby externally, as in the form of drops, and because breast milk doesn't transmit vitamin D, and so all over world, vitamin D is preferable 400 international units, irrespective of the weight of the baby, till 1 year of age. So we should supplement the baby with vitamin D drops, 400 international units till 1 year of age. Nothing else required. If you're giving breast milk, nothing else except vitamin D from externally, not even water mainly.
Yeah. So I think she's very clear, irrespective of it being breastfeeding or
Yes.
not, because there is no vitamin D in that, is why we ask you to give
Mm.
vitamin D drops.
Mm.
So that is the importance of
Yes,
giving
yes,
the
right.
vitamin D syrup.
Mm.
Now, when there is a baby fussy and colicky, the whole family is disturbed, everybody, and then they bring in this gripe water as the solution for it.
Yeah. So this is very, very important for all of us, ma'am, because it comes from the grandmothers and grandmothers, for four grandmothers and all. It comes coming from there. Changing in the mindset is like very
More
tough.
important.
Yeah. So the thing is, first the colickiness of the baby or gas forming of the baby. See, forming a gas in the intestinal abdomen is very, very normal thing. After they digest amount of the milk, there is some part of the gas, and any discomfort or any comfort, then how the baby tells to us in the form of cry. So they keep so if there is a gas formation or discomfort, till the baby passes the gas either in the form of burp or in the form of an flatus, the baby will cry. That is a very, very normal thing. We need to give that comfort the baby, putting in upright position or tapping the baby, soothe the baby, and soothe the baby and see. For that, no need to be worried at all. If too much of pain and not able to console at all, then definitely you need to consult the doctor and see what is it happening with the baby. Next, the most important, gripe water. So if you see the gripe water, the history, they starts whatever the brand they started with alcohol based. Like just imagine minute amount of alcohol they started with that brand. So slowly they change and they're claiming it they have removed the alcohol from the gripe water per se. If you see the gripe water contains all the still seed oil, sodium bicarbonate, all plant based oils they have added. So some kind of sedation will be there on all these oils and all. So the baby sleeps after that, comforts after that. So gripe water is strictly no, contraindicated for the babies. There are so many studies proving it is not necessary for the babies to get digested. When you are giving your baby a breast milk itself, nothing else is necessary to get digested. Okay, God has given us the enough amount of enzymes in the body to get digested. So when you're giving breast milk to your body, even when you're giving a formula to your baby, nothing else externally required to get digestion per se. So definitely nothing required except vitamin D3 drops and a breast milk. And gripe water is strictly no.
Okay, so let's do a fun section with Dr. Sindhu. We're doing a rapid fire. So
Okay.
let's discuss if the issues that I'm asking are normal or not normal.
Okay.
Hiccups in baby.
Normal.
Okay. Can you tell them why hiccups even occur?
So the hiccups in a baby, hiccups is because of the diaphragmatic stimulation that which usually the babies happens. So the common question is, should I feed when the baby is getting hiccups? Hiccups is completely normal, nothing to worry at all. It's not something else related to the milk or something that. But hiccups is normal. So yes, you can feed the baby if the baby is comfortable, or make the baby burp first. Try to get the baby comfortable in burping position and see the baby is comfortable and baby is able to take the feed. Yes, feed the baby and see whether the hiccups can stop. But nothing to worry at all. Babies can do that hiccup kind of sounds until for about 24 hours, 7, 6 to 8 hours. This will be having the hiccups. It's okay. It's nothing to worry at all.
Is sneezing normal?
Very completely normal. We all know sneezing is an protective phenomena to
Yes.
clear our own nose.
Yes.
So any nasal block or something, they try to clear it out. If they are not, that's why they cause sneezing. If there is not able to clear, put a nasal drop. That's a saline drops, not even medicated drops. Put a drops in each nostril. It will clear the nose. The sneezing will come down at least.
What about rashes? Are rashes normal?
Yes, rashes are completely normal. But what all the rashes are normal is what we need to be. The reddish rash, the maculopapular rash of reddish, you can see that if you see morning hours, the baby will have the rash, and evening hours, there won't be any rash. This is not erythematoxin. All this all these are normal. Like pimples kind of rash all over happens in axilla, groin, pimples pus kind of things, that is also normal. Milia, like in sweat, when we have a few sweat kind of rashes, that is also normal. So all these kinds of rashes are completely normal. If you have pustules more than 10 in a particular area, then you need to consult with the doctor immediately. And mild around 3 to 4, and on the axilla, on the face, or in the sternum, or in the groin, it's okay. That can be get resolved by themselves. So all these rashes are normal. So the rashes and the add-on notice, rashes can happen. This on and off rashes can happen till 3 months of age, till that maturity happens. So until that, no need to take it so seriously. Apply moisturizer or a oil. It will be.
What about the stool pattern?
Stool pattern. So
Because they are so confused when there's an altered stool pattern or even change in
yes,
color.
ma'am. Yeah. So the stool pattern, the first 3 days of the baby born, you can see that meconium, which is dark black color thing. And after that, it will change into greenish 3 days. Then it will go to yellowish. By the end of the 5 to 6 day after, you will see that yellow color stools. And that is change in pattern of the stools. After changing the yellow color, sometimes they can go back to a light greenish color also. It's okay. Passing a huge amount of stools at a single time is normal. Passing a water with granules. I keep telling the same words with my patients too. This water with small granules thing. That is also completely normal. And taste like is normal. All these things are normal. And add-on is passing a stool about around 5 to 6 times per day is also normal.
Yeah, that's not loose stool.
That's not loose stool, and that we keep coming like a baby's getting dehydrated maybe. So it's okay, 5 to 6 times of baby passes motion is normal. And not passing stool for 5 to 6 days is also normal if the abdomen is soft and baby is accepting feeds, urine output is good. So nothing to worry, even you can wait up to 4 to 5 days if baby didn't pass stool also.
What about the sleep pattern?
Sleep pattern, yes. So the sleep is the main thing. They'll sleep in the night, they'll sleep in the morning hours, they'll wake up in the night hours. It's a common thing happens. So baby doesn't know which is morning, which is night until 3 to 4 months of age. So they sleep in the night, they sleep in the morning, they wake up in the night. It depends on the each baby. So the pattern is the baby does sleep. If you don't disturb the babies will sleep around 20 to 22 hours. That 18 to 22 hours, the baby does sleep. So you need to wake the baby up and then feed the baby every second hour, as I told you previously. So there is no change in the circadian rhythm for the baby like us. Morning we should wake up night. So you need to be adjusted according to the baby. The mother should be sleep when the baby is sleep, and the mother should be wake up when the baby is awake. That's the only thing we can do until for about 2 to 3 months. Then the baby slowly change the pattern of the sleep.
So I think Dr. Sindhu has beautifully spoken about how to pack your bags, how breastfeeding should be done, what is normal, that hiccups is normal, sneezing is normal. Now, can you help them with a checklist as to when they should reach out to you as a neonatologist, like red flags? These are the symptoms which are absolutely not normal, and you should reach out to your neonatologist at any cost.
Yeah. Yes, this is the red flag signs, as ma'am told, is number one, baby is not active. Baby is very, very dull. What does the dull means? If you tap the baby, normally if you tap the baby will be awake and show its startle reflex or the reflex pattern of the baby gets. If not like that, if we tap the baby and baby is like, what happened? And then again sleeps. That is called dullness of the baby. So the baby is dull and baby is not active, number one. Number two, if the baby is not at all accepting feeds.
Yes.
So the baby is not taking feeds at all for sucking and all those things. Baby is not taking the feeds. Number two. Number three, baby is passing less urine. So the urine output is less, yes. And number four is any change in color of the baby. If you see that lips and the body is changing into purple and all those things, get back. So these are the main four important signs for the baby to get back.
Even fever.
Even any that is all completely any fever. See, nothing is normal for the baby until 3 to 4 months. Like any fever or baby is having coughing, all these things are not normal. But immediate at an emergency, these four things are there. You have to get back to the baby immediately.
Yes. So until now we were only talking about the baby. So I think over the next couple of minutes, I would like to talk about the mother.
Yes.
Because
It is
as
very
the
important.
new moms, they have mixed bag of emotions. There's joy, there's excitement, anxiety. What is not discussed about is the
Everyone's
chances of
concentration goes towards the baby,
baby.
and they will be neglecting
Yes,
the mom.
yes. But what is not discussed about is the slipping into depression, and it is so
Very, very
underdiagnosed. 1 in every 10 pregnancies actually,
Oh,
they silently fight depression, and they're not even aware that they are in depression. So that is the reason that they don't even seek help, right? So post this live session, we would love to actually attach the checklist. So it is a very small checklist with just 10 basic questions. So you read the questions, and then you see what is the appropriate answer that you are figuring it out in, and then just tick. And there's a scoring below which actually helps you to assess if you are probably fighting this depression, because if that is the answer, then we're all there to help you out. There are multiple support groups, and all of us are there to help you out. You don't first of all have to be in the guilt zone when you don't want to handle your baby, or if you feel like crying all day, or if you don't, I mean, if you're having issues to even fall asleep, if everybody else in and around you is happy, but you're still very sad and not understanding, these are subtle signs of actually having a postpartum depression. You don't have to be in a guilt zone. It is not because you've eaten something or you haven't eaten something that this is happening, right? It is because of a sudden change in your hormones. What was there during a pregnancy, suddenly there's a swap of the estrogen and the progesterone levels post a pregnancy, and that is what results in these symptoms. So please read the checklist, figure it out, and because I feel that just because you're walking post a delivery, pooping well and eating well, that itself is not indicative that you're recovering post a delivery. What is more important is your mental well-being. So that is the first that I would like to emphasize. And the second is using your support system, right? Support system is your biggest boon, especially in a country like India when you have 2 or 3 other people in and around you. So I think you need to have your naps. So for you to have your nap, you can express a feed, use your breast pumps and express a feed. So I have most of my the patients, the mothers who keep saying that I want to give exclusive breastfeeding. Yes, whether it is from a direct breast or when it is an exclusive, when you have expressed a feed, the nutrient content in both of them are the same. Dr. Sindhu will back me up on this. So the nutrient contents are actually not reduced.
Yes. So that's very true, ma'am. First, the mother has to be happy to give the breast milk. So the three main things to get enough breast milk, if you see, that is, you have to be you should be very very happy. So your happy hormone should be there. So oxytocin is a happy hormone. So if you have a good happy hormone, definitely you'll get a milk. And if you eat good nutritious food, you'll get a milk. And third thing is either you breastfeed the baby directly or the pumping, same like a sucking. So then you'll get definitely milk. These are the three important primary things to get enough milk. Yes. Giving, if you're not comfortable, if you need some break about 4 to 6 hours if you don't take rest, you'll have stress hormones rise, you'll not get milk. So again the cycle again itself goes on. So you can expression or giving, you won't take a rest for 4 to 6 hours and you shouldn't get disturbed. Express and give it. Express and give it at least for a few hours and a few days. As I told you, circadian for the baby also will get tuned up. So that baby also will take to every second hour baby will get a feed and sleep. That pattern will take some time. Till that, at least you can express milk and keep in the room temperature, and 4 to 6 hours you can keep the breast milk.
So I think it's not about running behind. Give me medications to improve my milk supply. More than that, it is about you being rested well enough, hydrating yourself, and eating a nutritious diet, which will actually help you. Because Dr. Sindhu rightly pointed out, it is about you being positive and happy, which actually enhances the milk supply. So when you actually express this breastfeed, you can store it in a sterile container at room temperature for as long as 4 hours. Now, if you have a prolonged gap or you're traveling elsewhere, you can also store it in the fridge. When it is placed in the fridge, you can keep it for 24 hours. Dr. Sindhu, would you want to highlight how they should be feeding this express milk? Which is placed in the
this is very, very important. See, as I told you, express and give it. If you're not comfortable, if you want that piece. The thing is how you are giving is very important question which ma'am asked. Is like giving to a spoon or a pellet, but should not be given with the nipple, because again the baby should, after a few days after the baby turns into in a cycle of feeding and sleeping pattern, that time the baby will get nipple confusion. Now, there is an active suction, taking the milk and passive. See, this is the bottle. If the nipple will give you a passive one. Just put a bottle in the mouth. The baby will take the milk will go. The baby will swallow. That's it. Not of any energy. Any to do any work. When you take the baby to the breast, baby has to do some work to get a milk. Then the baby will not do it if you keep giving with the nipple. That's why nipple confusion starts on. So if If you want to give, definitely give. Yes, take a time, take rest, and give, but through the spoon, either through the palade, or we'll get a bottle with spoon. With that also you can give. With a normal spoon also, if you want, you can give it. The baby will take definitely.
Yeah, and you shouldn't be boiling this milk just because you got it out of the fridge, right?
Yes. This is the common thing which everyone does. No, never ever boil the mother's milk. Yes, baby will not take it. The babies are very smart, so they don't take milk if they are cold. So get out of the milk from the fridge, keep for half an hour, and then thaw the milk. Means putting a wide open container with hot water. Take the milk in a bottle and thaw it up. The milk will get literally a bit of warmth. Then you can feed the baby with that spoon.
Yeah, so please don't boil.
Boil, never.
Yes, and the other thing, even if you freeze it, right? If you've placed it in the freezer, you can store it for as long as 6
If you're having enough milk and you want to store for a longer time, till deep freeze, once you place it 8 degrees, you can put it around 6 months. And if you have more milk, please donate. Even we have a milk bank at Cuddles. So if you want to donate, our contact number will provide. You can donate milk to us also if you're having good enough milk for your baby.
Yeah, so it's not just donating blood or the blood donation camps. I'm not sure how many new moms are even aware of a breast milk bank which is available, because as neonatologists, they deal with a lot of extreme premature babies which are weighing less than 1 kg, 1.1 kgs. So that a few drops of the breast milk is very, very helpful.
Yeah. They are like an us for us. It's like more like diamond, more than gold for us, for the babies. Well, that is extreme preterm babies always. So if you are willing to donate, please let us know with our contact number. We will send you the person to collect the milk from mothers.
Yeah. So I think you should use your support system to the fullest.
Yes.
So express milk and use their support so that you could get your nap for 4 to 6 hours. Go for a 20 to 25 minute stroll. So I think walking itself, right, will ease out all that negativity in you and a little bit of happy hormones pumping in all over again. Hydrating yourself. If you notice the breast milk, 80% of breast milk is water. So if the mother is not hydrated herself well, if she's dehydrated, so I think that is a very common reason that there is a lack of the breast milk supply as well. So before every breastfeed, I always tell my patients 15 to 20 minutes earlier, you hydrate yourself well. Have a glass of water or coconut water or whatever suits you best. Hydrate yourself well, and you need to know that you need to take at least 500 calories more. So if you're a mother who's been taking 2000 kilocalories according to your body weight calculated in pregnancy, you need to add in an additional 500 kilocalories. By additional 500 kilocalories here, I do not mean a biryani, right? So it is more of a protein base, because a protein diet is what is going to again improve the milk supply here. And also from your grandmom's kitchen, so using garlic, yes, but it's the most common galactogone. Apart from that, ginger, fennel seeds, or even cumin, all of these subtle things which are available in Indian spices, which are already a part of our cooking, and water-containing vegetables. When you've taken, then again you're hydrating yourself well, right? So it's a good diet, good resting, and sleep, exercise, and apart from all of these, if you are feeling that you are not still happy, you are having trouble falling asleep, everybody in and around you seem to be enjoying the success of the baby, but you are in your own zone, wanting to cry all the time, having a suicidal tendency, please let us know. Nobody is going to judge you for having these symptoms. All of these are subtle signs that you're falling into a postpartum depression.
And this is not you. This is your hormones.
This is your hormones which is playing with you. It is going to just take months of time to get out of it. But please access help. All of us are here to help you out. All of us are here to hear whatever you're saying. Nobody is going to judge you. So I think we'll be happy to share our checklist.
Yes.
Dr. Sindhu has come up with a brilliant idea of actually starting a WhatsApp support group for all the moms. So we will be sharing the WhatsApp link in a couple of minutes, and all of you can, whoever is interested, the new moms can actually join the group. And because there are multiple doubts which probably when you have gone for your consultation you have forgotten to ask.
Yes.
And then every question pops in every now and then. Like the most commonly asked question, in fact, if I'm having fever, can I feed my baby?
Yeah. So all these questions, as ma'am told, yes, first you should be happy to make your baby, to raise the baby, confident baby. First, you should be happy. For that, all the hormones already we will have so much of stress feeding the baby all and day and night, and all the other hormones dancing in the brain. So this all this will leave you a bit of low. Yes, as ma'am told, seek a supporting system. Consult your gynecologist or obstetrician, whomever you are consulting, and get a support from them, get a counseling from them. Nothing wrong in it. See, I myself has seen so many mothers who are having so much of irritability or depression, going into the depression. So that is not. First, you should be happy to make the baby happy and to make people around you happy. Yes, the question which you asked, madam, yes, you can feed the baby even if you have cold, cough, fever, whatever illness you have. The only thing is wear the mask. If you have a cold and cough, wear the mask, feed the baby, and for further care, give it to the baby to your partner or give it to your baby, whoever is helping you. So, but when you're feeding the baby, wear mask and then feed the baby, even
Wash
for
your
the
hands
fever.
while you're handling the baby.
The two formats of transmitting any of the virus or the bacteria is through respiratory pattern or to the hands. If these two things are clean, nothing to worry. You have to feed the baby even if you have fever.
And I think as neonatologists, most of the time, so she keeps complaining to me that the mothers, but just before they breastfeed the baby, every time they're trying to clean off the breast, right? So that is a common concern that you especially see when they come into your ICUs to do the KMC and feed the babies.
So no need to be clean the area every time. There is some colonizing bacteria which is good for the baby when the baby sucks the baby. So no need to clean or with the soap and water on this thing. Area should be just have a dry clean, that's more than sufficient. No need to use and soap and clean the breast every time. You should be having the birth and clean because you are handling the baby. Have the bath and clean. But the thing is, no need to keep with soap and water, keep beside you and clean your breast each and every time is not necessary.
I think we've had quite a vast discussion about the most common questions that are being asked. I'm sure if any of the mothers have more questions, we can take the questions in the chat box. What vitamin syrups are recommended after birth?
I think I just told you, Anila, is not only vitamin D, which is necessary for the baby after birth. Vitamin D, that is 400 international units, which you are supposed to give till 1 year of age.
Which shampoo is safe for my
The same questions are getting repeated. I'm not a brand promoter. I don't have any brand link. So it's only the pH which matters than the brand, whichever we say. It's the pH is around 7.2 is safe for the baby. But strictly no powder. Very important.
Yes.
Powder is an irritant. So powder is not at all should be come in contact with the baby. Only the moisturizer, only the cream based one we can use. But shampoo, or I mean to say head to toe, whichever the babies will have, or a bar also you can use, but the pH should be maintained. That's more than
I think the biggest take-home point that she rightly pointed out is no powder, because we see a lot of them using
it's an
powders.
irritant.
Yeah, it is an irritant for the baby. Anir is asking you, my baby is sneezing all the time. I'm concerned. Yeah, sneezing is normal, Anir. So
Yes.
if your baby is having hiccups or if the baby is sneezing, I think you just have to calm down. Yeah.
Try with the nasal clear, Anir. In your nasal clear, nasal drops, clear the nose and see if we have a small mucus which are available in all the stores. So just put a nasal clear and clear the nose and see. Sneezing is a protective phenomenon. Clearing the baby's her own nose or his own nose. That's it. And so nothing to worry.
Can I feed my baby if I have fever? Yeah, I think Dr. Sindhu has just answered that question. Yes, you can feed your baby if you have fever. So always when you reach out to your obstetrician, she's going to be very sure of using the medications that are safe for breastfeeding, so you don't have to hesitate. And when you have fever, you're going to be dehydrated. Hence the importance of hydrating yourself also well, because that is the time, that 12 to 14 hours, when you might have a decrease in your breast milk supply if you're dehydrated because of a high fever. So hydrate yourself well, and if you don't have a cough or sneeze, you can handle the baby. But if you have a cough or other phenomenon, just wear a mask and
feed the baby. So feeding
it's this clean hands which matters the most.
So fever is not at all a contraindication for the breastfeeding. Please feed the baby.
Any more questions that we have? Is it safe for my baby to sleep on their stomach?
Yes. So prone position, whatever you're talking about, the baby in prone position, you can make the baby, but there are theories which says that the baby may have this sudden infant death syndrome if the baby is in prone position compared to supine position. So if your baby is comfortable in prone position, you can make, but some of the other person should be beside the baby compulsory. If you're making the baby to position in a prone and baby you want the baby to sleep, or some of the other eye should be on the baby. How is the baby breathing pattern and
I think
everything?
especially when they cover the baby.
Cover the baby. They make the baby squirt, cover it nicely and keep in prone position. No, but you can make the baby to sleep. But one or the other's eye should be on the baby to make the baby, whether the baby is breathing or comfortable or not.
Yes. Right. Is it okay to take medication while breastfeeding? So it depends on what kind of medication that you're mentioning about. Like we mentioned, when you reach out to your obstetrician, she's going to cross check with all the symptoms that you have, and all the medications that we give are breastfeeding safe. So don't pop in any over the counter pills. What you should be taking post to your delivery is, see, the story is not forgotten. Everybody, when they're pregnant, they're taking their protein powders, they take iron and calcium because they want the baby to grow. But once the baby is out, all the supplements are forgotten. I think it's very essential that you remember to take your calcium supplement. Just like how you give your vitamin D drops to your baby, you will also have to take your calcium supplement, which has calcium of 1000 milligrams and also vitamin D of 800 international units, which is very essential for the first 6 months when you are exclusively breastfeeding the baby. It's not the spinal anesthesia effect that my anesthetist gives, which lands up, because I have people who come after 15 years, 20 years saying that I received anesthesia and that is the cause of my backache. No, you haven't taken supplements and you haven't done your postnatal exercises. So these are the major factors to consider.
There's one question in the chat box. What is the age use water to clean potty? As I told you, you can use immediately also warm water. That is the best thing then compared to the wipes. So you can use a lukewarm water to clean the potty even after the birth. Okay.
And also when she spoke about diapers,
Yeah.
I think when there is a poop, you have to immediately clean
That's
it.
very. At least urine you can wait for some time, but poo is a definitely mild of acidic nature, which in coming in contact with the baby's skin will lead to so much of rashes. So yes, you have to clean it immediately after poo.
Can we bathe newborn babies 2 times a day because of the weather?
Yes, you can bathe, not necessarily to be a 2 times or 1 time. You can bathe the newborn babies, but it should be a quick bath. It's not like when we see mom, they take around half an hour to 40 minutes massage and then put all the powder, clean, and then wash the baby. It will take around half an hour to 40 minutes. Each bath taking so much of longer time. Again, leads to your baby will become so cold, again lose weight and all this. If it's a quick bath, yes, you can do it. But I think 1 time is more than sufficient for the baby to.
And also, if you want to give a bath more than 1 time a day, just plain water is sufficient the second time.
Quick,
You don't have
just
to use the body wash all the time. When should we stop the wet wipes?
I am asking to not to
She's
use.
asking you to not use wet wipes at all. So I think you can use a clean cloth dipped in lukewarm water. It is only when you're traveling, probably when you're traveling to your neonatologist for the vaccine schedules, or you're stuck in a car. That is when I think you should use a wet wipe.
Yeah.
Otherwise, you should just use a clean cloth, soak it in just warm water and clean. So the take-home point strongly advocated here is that no scented wet wipes, especially. So if you're using wet wipes, they should just be the plain water-based ones and not the scented ones, because majority of the ones which are available in the market are scented wet wipes.
When you that wet wipes and scented wipes, when you rub the baby, also this again leads to a rash for the baby and discomfort for the baby.
Yes.
There will definitely change in when you use that warm cloth and all. The baby will be more comfortable also.
Yes.
In and down, like when necessary and all, yes, you can use. I don't say that completely, but yes, wet wipes more than wet wipes, preferably is cotton cloth with warm water.
Is it necessary to shape up the head with pressing? Yeah.
Very common questions, Vanaja, you asked, is like not at all necessary. No need to tie the baby head, or no need to put some sesame, some pillows has come, all those pillows. See, if the baby is comfortable, use it. If the baby is not comfortable, don't use. It's baby's her own nature to turn the baby's head. It's not like my baby is sleeping only in one position. It's okay. The baby is comfortable in that position, and baby will change. Obviously, when this baby starts neck holding, baby will turn the head and change the positions by him or herself. So now not necessary to shape the baby. The shape of the head will turn by itself by the time fontanelle is the space in the head closes, that is around 18 months to 2 years. So no need to shape the body, press the baby, or put a cloth, or use certain particular pillows and all those things. Not necessary.
Anila is asking, can I give my baby juice or water before they're 6 months old?
So, as ma'am told, if there's only one point you all should keep in mind before ending of this session is direct breastfeeding or an express breast milk is only indicated for the baby. Milk, just milk, not even water, not even juice, not even honey, nothing.
not cow's
Only not cow's milk. Also, yes, I'm very truly said. It's like yes, only breast milk, only mother's milk. If mother's milk is not there, preferably is formula. That's it. Then only two things. And vitamin D3 drops. That's it. If you feel like baby is getting dehydrated, get back to the consultant, get back to the pediatrician, and see whether the baby is getting dehydrated. Then person will say what to give, what not to give next. But not at all any other things except milk or a formula feed, and that's main indicated. And that to 6 months, completion of 6 months. And usually after starting of 6 months, all this annaprasana will start off, and then they start feeding the baby. So 6 months completion, it should always be exclusive breast milk. After 6 months completion, yes, complementary feeding will start. Then we can discuss with your doctor what all to be started.
And like I'd already told earlier, breast milk, 80% of it is water. So don't be worried that it's summer and my baby needs water. The breast milk will do its job.
If you feel like baby is getting dehydrated, feed more frequently than compared to the previous time. Frequency will increase the frequency. That's more.
If you're confused about whether the baby has had sufficient feed or not, like Dr. Sindhu has already pointed out, check the diapers. So if already the baby is soaking diapers, and if you're changing 4 to 5 fully soaked diapers, then the baby is already a well breastfed, hydrated baby. So you don't have to worry whether you can give juice or water or gripe water. The only two things that you can give the baby is breast milk. Okay, if no breast milk, then there's a formula, and the second is vitamin D drops. Nothing apart from these two. Why is vitamin K given to newborn?
Yeah. So vitamin K immediately after birth we give it because vitamin K is synthesized in the liver and the gut. So that is not that mature and that is not transmitted from the mother to after birth. So immediately after giving, we are giving time for the baby. And what is vitamin K role is for clotting. So if you don't give vitamin K, already baby is not synthesized yet because the liver is not mature and the gut is not mature. So so that time if any small cut or something, baby starts profuse bleeding. There is no clotting factors adding on. So the vitamin K immediately after birth is definitely preferable for the baby. Should be given. Okay, and it's not a literal thing. After the baby starts synthesizing its own vitamin K from the liver and the gut, so that will be more than sufficient.
What should I do if my baby spits up a lot? So that's a good question.
Spits up. So spitting up of 1 to 2 ml after each feed, after giving a birth and all, the baby will take about 1 to 2 ml. That's nothing to worry. If the baby is taking huge amount and more frequently, so and if it is like around huge amount of milk every time each feed is definitely a worrisome. You have to consult because there is something called gastroesophageal reflux disease which happens for the babies, which is most common. Then that time you need to consult doctor and see should you get, because after seeing the weight gain pattern, after seeing how much amount of the baby is spitting up is seriously spitting up affecting the birth weight. So the weight is affecting up for the spitting up is what we should see and take a call on whether to treat or leave it until the baby get resolved by itself. So the reflex is there or not, we need to be seen.
Amir is asking, what is the recovery process like after a C-section? So recovery process, as in it depends on what was the condition in which, first of all, a cesarean section was performed. Because if it is after a vaginal delivery, she's able to walk about immediately and have all her meals. So after a cesarean section, if it was done because of high blood pressures, or it depends on why a cesarean section was performed. Generally, when the cesarean section was performed in a low risk person, so within 4 to 5 hours, we give them liquids, and within 6 hours post a cesarean, we give them a soft diet. We in fact even ambulate. We make them walk within 12 hours, and we remove the catheter, the urine tube, within 12 hours, and the mother is good to go home within 48 hours. So early ambulation and changing positions, and we have the physiotherapist who will actually help them with the movements to ease the pain. So good pain relief and good diet, and they're ready to go home in 48 hours after a cesarean section. So now that the question was asked about a cesarean section, so I want to also highlight about mothers asking for their abdominal belts before a discharge. So for a cesarean section, especially a low risk cesarean section, only if the mother is a very heavily weighed mother where she has a hanging loose tummy, just for the support, an abdominal belt would be sufficient. But if it is a normal mother where we've performed a cesarean, abdominal belt has no role in taking your tummy back in. So it only in fact causes wasting of the muscles there, because there are two issues like a rectus muscle divarication or even a hernia. So there are two different terminologies. What actually helps you to have a flat tummy after a delivery is doing your pelvic physiotherapy, abdomen strengthening exercises. So there are pelvic physiotherapists. In our team, we have pelvic physiotherapists who actually, at the time of delivery itself, educate the mothers what is the exercise structure that has to be done. And please take it slow. You have taken 9 whole months to grow a baby and deliver. You cannot expect to have a flat tummy immediately when the baby is out. So within a month after delivery, they have come very sad about the loose hanging tummy, or about not losing enough weight. So you have to give time for the tissues and the body to recover from the repair that has happened. Yeah. I think we've answered this question: when to start bathing a baby daily. So
you can bathe the baby daily, as I told you, and you can wait until the cord falls. That's very, very important. Why are we delaying the birth? Delaying the bath is mainly for the cord care. So you can wait until the cord falls and then start bathing the baby daily. As I say, it's like a quick bath. Or is within 24 also you can start hours also you can start bathing the baby. But the thing is, keep the cord dry. So that's very, very important. So you can start off after falling, and around say it take cord to fall around, it takes around 7 to 10 days. So by after that you can start bathing the baby daily.
I have a medical condition like diabetes and thyroid issues. How will it impact my pregnancy and baby? So yes, so when you actually come in for your consultations, we obviously check for the baseline thyroid levels and blood sugars levels. If both of them are maintained within the normal limits, they don't impact the pregnancy and the baby. If diabetes is to an extent that there is insulin requirement, or if there is a medication that is being put on, then you are at a closer observation. So all of us are high risk obstetricians with a multidisciplinary approach where an endocrinologist takes care of the diabetes and the thyroid issues. So I think it just requires a closer monitoring. You don't have to panic just because you have that medical condition. If you are planning a pregnancy, so when you should seek for help is before, prior planning a pregnancy, especially when you have conditions like diabetes and thyroid, because these actually impact on the formation of the baby. So multiple abnormalities that a baby can have. So that is why we always ask to seek help before planning a pregnancy, so that we do your baseline checks to make sure that your blood sugars are within normal limit and your thyroid is within normal limit. But just because you have a thyroid issue, you're not going to land up in a miscarriage. Or just because you have diabetes, you're not going to have an abnormal baby. If your diabetes is well controlled, your baby is not going to have much of abnormalities, because a well controlled diabetes, the chances of having abnormalities is only 1.5%, which is very less.
In case of baby, definitely, as I told you, thyroid. If you have that, if you have or if not, we have to test the thyroid for the baby for sure. And diabetes will not cause long term impact, but short term immediately after that we keep checking the values of glucose values and all those things, whatever necessary, like calcium, all those things which are necessary based on the baby, we keep a check on, but it's not going to be a long term carry on for the babies.
Shravya, thank you that we could help you out. And baby's weight gain pattern on depending on the initial birth weight.
Yes. So the usually all the babies will lose the weight in first 7 to 10 days. By the end of the 7 to 10 days, baby will reach the birth weight because all the water content will go off, and then baby will reach the birth weight by 7 to 10 days. Baby has to reach the birth weight by 7 to 10 days. Then after that, the baby will gain around 30 grams per day based upon the baby's conditions. So initially it will be 30 grams per day, then it become 20 grams. So we keep, that's where the main your postnatal checkups come to the pediatrician is mainly by the to check how is your weight going on, how is baby's weight going on, or tracking it out. So
don't compare
actually, it doesn't mainly depends upon the initial birth weight. Even if it's a 2 kg baby or a 1.5 kg baby, the baby should reach the birth weight, then it start gaining. By the end of the 2 months, where the growth spurts and all will cross, no, they will come into the track. So every baby growth will be different. We can't compare with the two babies. So not exactly depends upon the initial birth weight. It has to grow. They should always be an upward trend. That's the only thing main necessary.
Yeah, so they have growth charts where they plot the weight gain actually, and that will help us to identify if your baby is gaining enough or not. So don't compare your baby with your cousins or your neighbors and feel that your baby is not gaining.
Yes, very important. No comparisons. Every baby have his or her own growth patterns and his or her growth mind. So we can't compare it.
Is it okay to make a baby sleep in air-conditioned room?
Yes, it's okay to make the baby sleep in air condition or with a fan. The temperature of the air condition should be around 27 to 28. The baby's temperature should be 6.5 to 37.5. So that degree centigrade. That is important. Based on the surrounding temperature, you should be able to manage. If you keep a AC around 28 around, yes, it's okay. But the direct air current should not blow on the baby's face. Neither the fan nor the AC directly blow on the face. So that would be okay for the baby.
When to start potty training?
Beyond infancy, this question comes. But anyways, start after 18 months to 2 years, because before that, if you start again, baby will start holding again the other issues. So you can start around 18 months to 2 years. Start potty training approximately.
Usually there'll be strict diet for new moms, like they should not eat potato, brinjal. Is that true? I don't believe in this strict diet, especially most of them are just fed with these laddus. The first 1 week, they're not given protein because they think that the stitches are not going
They
to
form pus or something like that.
yeah, so they feel that there will be pus coming out of the wound. Any diet, a balanced diet, there is no strict diet that has to be followed. What we ask you to eat is less oily and less spicy or a less masala food so that it is easily digestible. Eat a lot of water containing vegetables. All fruits are allowed. A good protein diet. You can have your moong dal khichdi. You can have your rice with dal and all the vegetables. You can start off non-veg immediately after like 12 to 14 hours after the cesarean if you're comfortable and if you've passed your stool and if you're walking about, you can start. So you have to mix and match your vegetables. It is not a particular vegetable that shouldn't be consumed. All vegetables can be taken. All fruits can be taken. What has to be avoided is red meat or anything which is heavy on the digestive system. So you cannot have ice creams or because immediately when the baby is out, the first craving. So I had a mother last week. I think she was the witness thing there. So the mother said, throughout pregnancy, my husband didn't let me have Maggie. So can I at least have Maggie? Now, see, once in a while, a cheat meal is okay, but that is not what we advocate. That's not part of your balanced meal. When should we massage baby and which oil is good for newborns?
So, as we already discussed this question, that you can massage the baby when you start bathing, like even after 48 hours, you start massaging the baby, and oil is minimum of coconut oil is more than sufficient, which is available in the market. That is sufficient.
Yeah, and I think you shouldn't use a concoction of different oils, mix them, and
That
then,
is that
so
is
that
a common thing.
yeah, so that is a common thing that I also hear about. You should switch to only one oil, and it should be so gentle that you shouldn't do anything.
That should fit for the baby. That's it.
Yeah, that's all. What types of food can we give a mother to help her baby gain weight? Because baby has only one source, and that is mother's milk. Yeah, so a good protein diet is what is going to help the mother to gain the weight, for the baby to gain weight. So adequately being hydrated, 10 to 12 glasses of water is essential. So this can be in the form of coconut water or your lemon juice, whatever, but take a lot of liquids and eat your fruit. Do not drink it because all the fiber content in it is gone. So eat your fruits, have nuts, and a good protein diet. Include your egg whites, and have your chickpeas, and your lentil soups, and your dal. So a good protein based diet with a lot of vegetables is sufficient enough for a good milk supply. And adding in fennel seeds, barley, or even cardamom, and garlic, ginger, these kind of spices. We'll be happy to actually share a diet chart post the live show, so that you can actually see what are the recipes, the traditional Indian recipes that you can follow to improve the milk supply. Vasanti is asking how to ensure baby head shaping correctly. I feel like more of flat in the backside. My baby is 6 months old now. The initial part till when the baby is neck holding didn't start, it will mold itself. So we have the shape of the head will keep changing till about 18 months of age, because as I told you, the fontanelle will be closing around 18 months. So that from till that time, we have the time where head grows and shape changes, and there will be a flat on the back side initial part. But once they start rolling over, when they start of sitting with support and all, in the neck, when it stabilizes, and the neck part will get normalized. If you seriously feel there is a flat head in the occipital region and all this, is get it checked once and reconfirm that your head is going in correction. But no need to worry to compress or decompress it or something, which we usually does, trying and all those things. But a normal flatness is okay, because until they get the neck holding and stabilize their neck, I mean they roll over and all. But seriously flatness till about after 6 months and 8 months, then get it checked and reconfirm it with your consultant. So I think due to time constraints, we probably should wind up. Is it okay to consume alcohol while breastfeeding?
Yeah, but no, strictly no. So till now, everyone will ask like what food to eat. Yes, it is definitely transmitted to the baby, highly protein diet and all those members telling. But alcohol, yes, it's not at all indicated for the baby, for the lactation mothers mainly. So not at all.
So alcohol in general is not allowed while breastfeeding, especially. But if you are bound to consuming alcohol, one of the options is to have wine, but then you should have expressed your feed, and then after you've consumed that, 6 hours after you've consumed, you just have to express that milk out and not feed that expressed milk to the baby. So in a general, I am not saying you should consume alcohol. It's strictly no. And majority of our guidelines stick to the fact that you shouldn't consume alcohol while breastfeeding. Okay. Due to time constraints, I think Dr. Sindhu and I have to wind up this session. It was wonderful discussing about what we see in our day-to-day practice, especially because as new moms, most of them are overwhelmed and not understanding if it's normal, not normal. Because of social media, they see somebody so happy on Instagram, smiling all the time, and they're like, I am out of sleep, I'm not able to perform, and I am low. No, what is shown is only their few happy moments. They're not displaying their entire life. So wherever you are, whatever you're doing, you are doing 1000% for your baby. If you are confused about the symptoms that we discussed about, we will be sharing the PDF which has the 10 questions, which is a very, very essential scaling to check if you probably have signs of postpartum depression. Dr. Sindhu is going to be sharing the WhatsApp link
Yes.
where all the mothers can join in the support group where you can ask in all your common questions. We will share the diet chart in that, the feeding positions in that, and also the postpartum depression scale in that. It was wonderful communicating with all of you. So if you want to reach out to us, I'm Dr. Nikitha Reddy and I'm available at King's Gachibowli from Monday to Saturday between 9 to 5. And
yeah, thank you so much. It's very nice interacting, and I think it's very useful for the new moms who have so much of confusions in their mind, which is normal, which is abnormal. And yes, for any time, I'm Dr. Sindhu, available at Kim's Cuddles Gachibowli from morning 9 to 5. So thank you all for joining us.